Hi friends, once again welcome to Pharmacology. So we'll continue with the pharmacy exam multiple choice questions. So first one, all of the following hormonal drugs possess a steroidal nucleus except options are ethinyl estradiol, norethindrone, leothyronin, prednisolone, fluoxymestrone. Here the answer is option C, that is leothyronin. This leothyronin is a thyroid hormone. Thyroid hormones consist of iodinated aromatic amino acids and are not steroidal in nature. Ethinyl estradiol is a steroidal estrogen, norethindrone is a steroidal 9D-norprogesterone, prednisolone is an adrenocorticosteroid, and fluoxymestrone is a steroidal androgen. Which of the following compounds is incorrectly matched with one of its therapeutic uses? Options are raloxifene, ovulation induction, metformin, type 2 diabetes mellitus, finasteride, benign prostatic hyperplasia, propylthiouracil hyperthyroidism, tamoxifen, estrogen dependent breast cancer. So here we need to find out the incorrectly matched pair. That is, which one is incorrectly matched with its therapeutic uses. So here the answer is option A, that is raloxifene ovulation induction, which is the incorrect pair. Raloxifene is a SERM, that is selective estrogen receptor modulator, and it is not used to treat ovulation induction. Clomiphene is currently the only anti-estrogen that is approved for the induction of ovulation in women who have ovulation failure. Instead, because of its ability to reduce bone resorption and decrease bone turnover, this raloxifene is used for the prevention of osteoporosis. All of the other four compounds are correctly matched to their therapeutic use. Finasteride is also used to treat androgenic alopecia. Next one, which of the following is not a harmful food drug interaction? Let's see the options. Raw green salads for patients on warfarin deep vein thrombosis prophylaxis. Then grapefruit juice and cyclosporin to prevent graft versus host rejection of a transplanted kidney. Then omeprazole beads in applesauce for a patient with problems swallowing capsules secondary to gastroesophageal reflux disease. Then milk with doxycycline to treat Helicobacter pylori. So here the answer is option C, that is the out of these options, the one which is not a harmful food drug interaction is option C. That is, omeprazole beads are enteric coated. Giving an enteric coated bead with an acidic food such as applesauce preserves the enteric coating and allows the drug to pass intact through the acidic stomach environment and into the basic duodenum environment where it is absorbed. The result is improved drug absorption and decreased drug destruction in the acidic stomach than if the beads were not in an acidic food. Hence, the third one is not an harmful food drug interaction. Remaining all others are harmful drug food interactions. A 45-year-old long haul trucker suffers from seasonal allergies. He asks advice on which over the counter product is best to relieve his symptoms. Which of the following choices is the best recommendation for this patient? Options are diphenhydramine, promethazine, clemastine, chlorpheniramine, loratadine. Here the answer is option E, that is loratadine. This diphenhydramine, promethazine and clemastine all possess moderate to strong anticholinergic activity. This will increase the risk of sedation, which could prove dangerous in this patient. Chlorpheniramine, although the least sedating of the first generation drugs, still may cross the blood-brain barrier and cause some sedation. Loratadine, as a second generation drug that has minimal anticholinergic activity and does not cross the blood-brain barrier, thus producing no central effects, is least likely to cause sedation and thus affect his job. Which of the following choices would be most appropriate in treating nausea and vomiting associated with motion sickness? Options are diphenhydramine, brompheniramine, ondansetron, omeprazole, ranitidine. Correct answer is option A, diphenhydramine. Although ondansetron is used for nausea associated with chemotherapy and anesthetics, it is not typically used for nausea associated with motion or vertigo. Diphenhydramine, which possesses a high degree of anticholinergic activity, is effective in reducing nausea and vomiting associated with vestibulocochlear activity, vertigo, and motion sickness. None of the other choices directly reduces nausea or vomiting. Therefore, diphenhydramine is the best choice. So that's all for today. Thank you and have a pleasant day.